The Minister for Health is said to have given assurances that services at Portlaoise Hospital will not be downgraded. 24 hours after 2,000 people took to the streets in protest, James Reilly met with a delegation of local Oireachtas representatives, and three of those join us this morning: Fine Gael TD Charlie Flanagan, Sinn Féin TD Brian Stanley and Labour Senator John Whelan. We've been unable to make contact with Fianna Fáil TD Sean Fleming. John Whelan, to yourself first of all, you've described this as a very fruitful and a positive meeting. So what was said to leave you with that feeling?
Yeah, well, first of all, I was delighted that the Minister took time out of a really busy schedule to meet us so promptly on Monday evening in Dublin in his offices there at 5 o'clock yesterday evening. And I have to, give credit where it's due to Deputy Charles Flanagan as well for arranging the meeting, because if he didn't, I'd be the first to criticise him. The Minister was there. He gave us an hour of his time. He answered all our questions, and his officials remained on in the room, 6 or 7 senior officials and advisors, for an hour afterwards, as the four of us probed him and asked further questions and clarification. And so the immediate issue is that there is no reduction or diminution of the A&E services, the 24/7 A&E services at Portlaoise, which was the first critical issue. We're also assured that Portlaoise will have its full quota of junior doctors in place in Portlaoise come July the 11th, the key date for the rotation of staff, which means that service provision can continue as normal. And the Minister then went on to caution HSE officials in front of us that he did not want any playing games with Portlaoise or its services, and that any decisions pertaining to Portlaoise would have to be put to him and run past him firstly. So he's taken full responsibility, and I'm glad of that nothing is going to be done behind closed doors or behind our backs. And I take the Minister at his word. I trust him. I believe in what he says. And, we have to do that. And I believe also that when he says that there will be no downgrading and no plans whatsoever anywhere to close Portlaoise Hospital, but rather to develop and upgrade it. And so I was very heartened to hear those things. Now, there are other ongoing concerns
just to give Brian Stanley an opportunity to come back in here. Brian Stanley, are you as satisfied and as confident of having heard what the Minister said?
Well, the first thing, Will, is that I would say is that I welcome the fact that the meeting happened, and it's just good to get a face-to-face meeting with the Minister, for the Oireachtas representatives, and it's a great opportunity to convey the concerns of people in County Laois, all those who have protested and campaigned in recent weeks for it, and they're to be congratulated for that, because that was very important. Certainly, I came away from the meeting happier than I went into it, because, there's huge concerns, have been huge concerns in relation to Portlaoise. And the Minister, as John Whelan did say there, the Minister did set out very clearly that he has no plans for closure or reduction of services.
So is that the end of the matter, or do you still have reservations?
Well, he said that he sees no danger to the A&E. Now, he did put in the caveat that as long as, and this is exactly what he said, as long as we have safe services, and that's a direct quotation from that I wrote down. Now, therein lies the problem, because obviously if you don't have safe services, then you're in trouble. And, there are problems, and these problems were discussed at the meeting in relation to the shortage of consultants. The problem with the junior doctors, he gave us an update on that, where things are at with that, and it certainly is more optimistic in terms of the recruitment process. It seems to be going fairly well in terms of recruiting the NCHDs, but we're not over the line yet on that one. I would have concerns about the number of consultants, but the meeting was a meeting of two halves, Will, in that there was the meeting with the Minister first of all for around 50 minutes, and then as John Whelan outlined, the senior officials stayed behind. And where I have concerns is that in the more medium to long term, looking out there are talks of there was discussions around this model, what's called a model plan for hospitals, and ranging from 1 to 5. One having the most important status, and where Portlaoise might fit into that. And one of the huge concerns that I have there is that Portlaoise, and the officials set this out for us, would need to be pegging itself should be pegged up as Model 2. The problem is to achieve Model 2 status, you would probably have to knock the existing hospital and rebuild and build a new one.
Right. By the way, in what order does the number improve? Is 1 best or is 5 best?
1 is the best. 1 is the best, and
No, Brian, sorry, it's 5 is the highest status.
Sorry, the other way around. But what I would say to you is this: is that the people who were there, they did acknowledge that Portlaoise was a significant regional hospital, and that's important. That's what, and like, in fairness, all four Oireachtas members, you know, regardless of which shade of opinion we represented, we pressed that point early on in the meeting that was a key issue for us.
Okay, I want to hear from Charlie Flanagan as well, the Fine Gael TD for Portlaoise. Charlie, are you as satisfied as the other two speakers here in general with what James Reilly had to say?
Well, you heard my colleagues from different parties, and I'm pleased with what John has said, and I acknowledge what Brian has said. We did have a positive meeting. I was asked by the leaders of the very well-attended march on Sunday to present a letter of protest to Minister Reilly. I did. He read it. We outlined the unique position of Portlaoise in the health service delivery area, the 20% increase in population in Laois, the unique matter of the prison, the fact that it was a busy regional hospital with 42,000 procedures last year and should not be compared with other hospitals that are in the news apropos downgrading. And the Minister did acknowledge that Portlaoise should not be classified in the same terms as other hospitals that are engaged in some controversial protests at present. The Minister went on, as John and Brian have now acknowledged, to state in explicit terms that there's no threat to the 24/7 round-the-clock accident and emergency service at Portlaoise. There's legislation to be passed through the door on Thursday to facilitate these new doctors, not only in Portlaoise, but all over the country. And I hope Brian's party, Sinn Féin, and Sean's party, Fianna Fáil, and John's party, Labour, support Minister Reilly in the passing of this legislation because it's urgent. That will allow for the contracts to be signed. Currently, the doctors are in line for Portlaoise for next Monday. This was the issue, a shortage of junior hospital doctors. We have received clarification that they are now lined up to start in Portlaoise next Monday, but their papers are currently being assessed, and they won't have their practicing certificates until after the legislation is passed. That's absolutely essential, Will. And the Minister appears confident that will take place, assuming the legislation is passed, assuming that the assessments of the individuals on their papers are in order. So that matter...
Okay, so contingent on those two caveats,
yes,
the normal service should continue.
But you see, people come back and say, you know, that's not a guarantee. But you see, it's guarantees or letters purporting to be guarantees. That's what has Roscommon in the trouble. That's what has Sligo in the trouble. I don't wave letters around for ministers, Will. That's not my politics. What I am saying is that I'm reasonably confident that this issue will now be resolved next Monday in Portlaoise. I'll be voting for the legislation. I hope the Sinn Féin party vote for the legislation. I hope Fianna Fáil vote for the legislation.
Okay, well, let's find out what the Fianna Fáil position is, because Deputy Sean Fleming joins us. You believe, Sean, that there is a need to be vigilant about the future of the hospital?
I do indeed, and yesterday I just want to concur with all my colleagues. It was a good meeting in terms of the immediate crisis next week for the A&E 24-hour service, and that I am satisfied that problem, you know, is now okay, and there's not going to be a problem. You know, in terms of written guarantees that we'll all be alive, you know, into the future, nobody can ever do that. But as much as anyone can be certain of anything, I'm satisfied that the 24-hour service will pass. Next thing that you do mention there about the future, two other points, and you were probably referring to a statement I sent into Midland Radio 3 yesterday, calling on all parties, saying that I will certainly, and Fianna Fáil will support emergency legislation on Thursday so that these new A&E doctors can be located around the country next week, and they can't actually take up the registration with the Medical Council unless this legislation is passed. And it is essential that the independents and Sinn Féin don't play silly games and start voting against the government and in some way maybe damage A&E units around the country. Now, in terms of what you said, need to be vigilant for the future, I even said that before the meeting, and it was confirmed at the meeting yesterday, where we had an hour-long session with the most senior officials in the HSE, who essentially outlined their plan for Portlaoise down the road, which is Portlaoise should be a hospital for a massive amount of daycare surgery procedures, but not for major serious issues where people require long-term stay for several nights or a week or two at end. They do want to, if the official plan comes into action over the years ahead, configure the surgery aspect in Portlaoise Hospital. A lot of surgery, but daycare surgery is really where they want to emphasise Portlaoise for the future, rather than maybe James's and the Mater and Vincent's are the places if people need major surgery for weeks on end to go to places like that. So there is possibly a change down the road, and there could be more to be gained in terms of health services locally than we currently have, because we have a small surgery staff. We have a limited number of consultants and physicians in the hospital. They say if you have a lot of day surgery, all new surgeons will want to come and upskill and get training, and it'll be very good for them based on the model of the hospital they're proposing for the future.
Okay, so what we're hearing from all four of you is that for the immediate future, none of you are particularly concerned following James Reilly's comments yesterday. Just one last point to clarify, since Sean Fleming, you've stated Fianna Fáil will support the emergency legislation. Charlie Flanagan, that's your position as well. John Whelan, I take it as a foregone conclusion that's the point of view of the Labour Party as well?
Well, it's important to note that the Senate is sitting on Friday to facilitate this emergency legislation, and anyone in their right mind will support this legislation to facilitate the recruitment of junior doctors for the hospitals all across the country. There's one final point I would like to make, that the Minister and the officials did also confirm that over the last 30 years, Portlaoise Hospital has been under-resourced and underfunded comparative to the amount of productivity and operations that it does. That, for instance, compared to Naas, Portlaoise does twice as much activity, yet has 1/3 less the budget. And this is something that Portlaoise is now trying to deal with and play catch-up with on a legacy basis.
Whatever about acknowledging it, did the Minister make any commitment to reverse that position?
Well, it's very hard to catch up on a 15 million deficit in the current budgetary climate, and he made that very clear as well. But what he did say was that we're saying now that as public representatives for the area, it's up to the senior hospital personnel now to put their best foot forward and put forward a progressive plan for the development of Portlaoise, and to embrace that opportunity so that we do get the resources and the funding that we require to maintain the status of the hospital into the long term, as Sean points out.
Okay.
Could I make a final point, Will, before I go? There has been a real difficulty, and there continues to be a difficulty with trust and the HSE. I said when I was in opposition that I regarded the HSE as dysfunctional. Not much has happened since the general election to change that, but it's happening. We had a difficulty meeting Mary Harney and previous ministers, but no difficulty with James Reilly. But the matter of trust between communities and the HSE must be addressed, and the HSE have tried to do a big job to convince the people of the Midlands and to convince the people of Laois and Portlaoise that they have the hospital in Portlaoise top of their agenda. And the final point to make, and I made this to you before, and I made it at the march on Sunday. I don't have in-depth and detailed medical expertise. I don't have a medical background. I don't profess, therefore, to be expert in these important, complex matters of life and death. I am reliant, therefore, on experts, and I will be relying on the clinical directorship of Portlaoise General Hospital. I will be relying on the expertise within the HSE to assist in developing what to my mind is a first-class hospital and must continue to provide adequate service for the people of County Laois.
Okay, and I want to give the last word to Sinn Féin's Brian Stanley, because the other parties have declared their position regarding the emergency legislation. Will Sinn Féin be supporting it?
Well, just one quick point just before I go to that. Just in relation to the consultants, we have a problem in Portlaoise in relation to consultants, and that's an issue that's going to have to be addressed not in a year or 2 years' time. That's an issue that's going to have to be addressed this year. That's one issue that we need to keep our eye on. But just in relation to the legislation, our party will be meeting this morning. We'll be having our weekly meeting, and we'll be going through what legislation is coming up this week in the Dáil. And unless I don't see any...
Well, I was about to ask, could you foresee any reason to oppose it?
Pardon?
Could you foresee any reason why the party would oppose it?
I don't foresee any reason, but I haven't discussed it with our health spokesperson yet. This is emergency legislation, which I'll be discussing with Quavian O'Quillan this morning at our party meeting. He's our spokesperson on health. And, if the legislation is doing what it says it does, I see no reason why we shouldn't.
Yes, well, I was about to ask, given the importance it will have for your local hospital, could you see yourself voting against it?
It would have to be. There would have to be very, very good reasons, but I don't know of any reasons that exist to oppose it. So, as I say, when I discussed it this morning at our party group meeting, we'll make a decision on that. But I look forward to this going through, and the the doctors being put in place.
We'll leave it there. Sinn Féin TD Brian Stanley, Fianna Fáil TD Sean Fleming, Fine Gael TD Charlie Flanagan and Labour Senator John Whelan. Thank you all very much for joining us this morning. Now, you've heard from the 4 Oireachtas representatives in Laois who met with the Health Minister James Reilly yesterday, and while some have reservations about the provision of certain long-term services, they all seem satisfied that sufficient staff levels will be in place to sustain services beyond July 11th, the date when junior doctor posts will rotate. Well, Peter O'Neill is spokesperson for the Portlaoise Hospital Action Committee. Peter, you're welcome to the programme.
Thanks very much, Will.
Are you as satisfied as the 4 speakers we've just heard from?
Well, we haven't had the opportunity to meet our Oireachtas delegates naturally, but I mean, listening to the radio there and the interviews with them, I'm very heartened by the comments, and they seem to be doing their work. You know, it's very good to hear that James Reilly has made a commitment that Portlaoise services won't be downgraded, and I'm well aware that Deputy Flanagan, Fleming, Stanley and Senator Whelan are all pushing for the case of Portlaoise Hospital, and that's their agenda. So, yes, I am heartened by their comments.
What was the big question or big questions you wanted answered?
Well, the big question, Will, was that they were going to close the A&E from 8 o'clock at night until 8 o'clock in the morning and deal with very, very minor cases, and the smallest of injuries would have to travel outside of the county to be treated, even for a sprain. So, you know, I think to keep that open and that particular service is imperative, you know, for the hospital's future, because once you start tinkering and taking little bits and pieces, it won't be long then before we're decided that we could be travelling into the middle of Dublin City to the Mater Hospital for treatment.
So will the group that you're part of remain, or will you disband now that these assurances have been given?
No, it's a single issue. It's a single issue group, and I just want to highlight that. It's completely non-political. It's cross-county. We have people from Portarlington to Cretty Yard, from Emo to Rathdowney, Portlaoise, and that was a decision made by the meeting that we would have a completely cross-county group. I would foresee that group will stay in place. I would see that we meet with our Oireachtas members as soon as possible, just to get their comments and get the report back. There was two agendas on our meeting last Wednesday night, and that was to form a committee, organise the march for last Sunday, and to keep on top of our Oireachtas members and get a report back, to get a cross-political front and to get a report back from them. We achieved the first one in having our march, a fantastic march last Sunday with over 4,500 people from all walks of life, and I just want to thank everyone for coming out in support, and all the people who helped with providing materials for placards and different things. The second issue then is a report back from the Oireachtas committee, which I've no doubt we will have before the end of the week, and I would see that we would stay in place and just keep an eye on the ball.
Keep a watching brief.
Yeah.
Peter O'Neill, thanks for taking our call today.